Hello. Okay, so you are here because you were in the ER the other night, right? So sorry about that. And they did a cranial nerve exam on you, is that right? And you failed some of the tests. Okay, alright. Give me just a second. Go over something. Okay, so you had a contusion to your head. And how is that? It's better. Okay. Alright, so the reason why you're here today is because, again, you failed those tests. So what they're going to do is they want us to check it for you. We're going to do another set of tests, cranial nerve tests, just to make sure everything's working okay. I've got a list here of what you failed. Of course, I'm going to go through all of them again just to be sure. Okay, alright, so again, this isn't going to hurt. It's the same thing they did the other night. We just need to make sure that everything's okay with it. Okay, alright, so give me one more second. I'm going to review this real quick. Okay, so I'm going to just check your breathing and your heart rate. Just part of the, there's no need to check everything like your temp or your blood pressure, but this I do want to check, especially your breathing, making sure that after your head injury, your breathing is normal. Okay, so if you will, just hold still for me. I'm gonna just check in your heart rate. Okay. Alright, now I need you to breathe in deep for me. Hold it, and then when I say, you're gonna let it out, okay? Alright. Breathe in as deep as you can. Out. Again, breathe in as deep as you can. Out. Okay. To the back. Lean forward for me. Breathe in as deep as you can. Out. Okay, breathe in as deep as you can. And out. Okay, good. Alright, that seems fine. So now what I'm going to do is I'm just going to do a series of muscle tests. I'm probably going to do a few of those, then do some other tests, and then finish out with a few more muscle tests, but I just need to put my gloves on since I'm going to be touching all over your face. And you haven't had any more pain, any head pain? Okay. Again, I'm very sorry about your injury. Okay. Let me, just a second. Okay. What I'm going to do is I'm going to be kind of pulling on your face, pushing it to the side. When I ask you to do something, you just follow my instructions, okay? You're basically going to be fighting against what my hands are doing, okay? Alright, so just pulling down on your jaw. I'm going to pull your mouth open. Just let me pull it open for now. Okay, now try and close it. Try to force it closed while I pull it open. Okay. That seems alright. Okay. Again, pulling it down. Try to force it closed. Okay, now I'm going to be pushing it up, like to close your mouth. You can try pushing it open. Good. Okay, open your mouth wide. I'm going to be, this may sound silly, but I'm going to be pulling against your cheeks right here, pulling them apart. It shouldn't hurt though. Let me know if it does. Okay, pulling up like that. Good. And you try to close it. Don't try to close it too hard though, so you don't bite my fingers. Okay. Alright. Maybe kind of shifting your jaw side to side like that. Just let me shift it. Okay, good. And I'll be turning your head. Okay. Side. And the other. Okay, that's good. Side to side. Just let me turn it and guide it. You don't have any pain, do you, when I'm doing any of that? Okay, great. Okay, let's go ahead and do your brow area. I'm going to be pushing up right underneath your eyebrows, and I want you to try to frown and close them down, okay? Right. Up. Up. Up, up, up. You can close them down. Good. Once again, pushing up. Up. You close it down. Good. Alright. Now I'm going to be pushing down, and you try to raise your eyebrows, okay? Pushing down. Down, down, down. Up. Up, up. Good. Down. Down, 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 down. Up. Okay. Okay. The midsection of your face on your nose area. Try to, if you can't wiggle your nose, if you'll move your mouth side to side, it should make your nose move. I'm going to try to move it one way and you try to move it the other, okay? Right. I'm going to push to the left and you try to go right, okay? Push to the right and you go left. Okay? Alright, that seems fine. Now on your brow area, I did notice a little bit of weakness on your left side. It doesn't look like you're drooping at all on this side at all on your brow area, but or your eye, but I'm gonna do a little bit more of an extensive check just to make sure that that injury didn't cause some type of damage that's still trying to heal or has not healed yet. Okay. Just making a note of it real quick. Alright, so I'm going to use do what's kind of like an ultrasound and look at it here on the screen. So I've got this jelly that I want to put on the side of your head, okay? It's kind of cold, I'm sorry. And then we'll put it above your eyebrow and on your temple area, okay? That way I can do the ultrasound on it. Just got my little ultrasound device here. So if you will, just hold still for me. I'm just going to be pressing. I'm going to start with your temple area. You can just look straight ahead or you can close your eyes, however you want to do it. It just should feel a little bit warm. Go ahead and turn your head for me. Thank you. I'm going to take some pictures as I go. Okay, just keep your head still right there for me for just a second. I'm going to look at something. Making sure I'm not missing anything. Okay. When I tap right here, do you have any pain? Do you feel it when I tap there? It doesn't feel like it's asleep, does it? Like it doesn't feel like a tingling sensation. You just feel... Does it feel the same on this side as it does on this side? This side feels the same as this side. It does? Okay. Okay. No, that's fine. Get one more here on the side of your temple. Okay. I can look at those more in depth later. The next thing I'm going to do is do some more testing, some hot and cold, hard and soft test on you. So what I need you to do is go ahead and close your eyes for me. And I'm going to do either a hard or soft test. I have a device that's either going to be hard, pointy, or soft, fluffy little soft thing. So go ahead and close your eyes for me and face me straight ahead, okay? Alright, so go ahead and have your eyes closed for me. Tell me if this is hard or soft. Good. 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 Almost dropped something. Good. 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 You're doing great. Good. That seems fine. Okay, now I've got a device. One has got a heated light on it, so it's going to feel warm, the tip of it. The other one is very cold on the end. So keep your eyes closed for me, and you're going to tell me if what you're feeling is either warm or cold. Okay? Alright. Warm or cold? Good. 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 Okay, good. Great. That's fine too. Now I need you to tell me if you can feel moisture on your face. So I've got some drops. I'm going to put them in different areas. So I'm going to put these drops in different areas on your face. And I need you to tell me what part. Is it on your forehead? Did I just put it on your cheek? Hold your head back for me like that. Okay, and keep your eyes closed. All right. Good. Chin. Good. Which side of your forehead was that? Good. Same side on your cheek? Good. Right on your nose? Good. Don't worry, I'm going to wipe all this off for you. Good. And one more. Middle of your forehead. Great. That's good. Go wipe it off. It was just water. It's not a... But I still need to make sure that you can feel that. Okay. So, for the most part, everything seems fine. But I do want to check one more thing. I'm just going to massage your face area, and I want you to tell me as I massage in certain areas, I'm gonna kind of like do a deep massage. I need you to tell me exactly where you feel it at, okay? I mean, that sounds extremely simple, but sometimes if you have a contusion and you've lost sensation in one area, you genuinely cannot feel it, and we need to make sure about that, okay? I'm just going to be massaging an area, and be sure, okay, close your eyes for me, okay? Alright, tell me exactly where on your head I'm massaging, and I'm going to press. Tell me if I'm pressing hard or massaging. Okay, good. Now what area am I massaging? Good. Okay. What area now? Good. Okay, I'm going to start just tapping. Which area? Good. Good. I'm doing a larger area. Good. So you've passed all the tests. Everything seems fine. Again, when you're in the ER and they're doing these tests quickly, sometimes you can feel them just because they're doing them quickly, but also you may have had some sensations that were not working correctly right after the injury, but they seem perfectly fine now. So you are good to go, and we can send this to your main healthcare provider. That way they know that you are free and clear, that you do not have any lingering impacts from the accident, and everything seems to be fine. But if you do notice any changes, if you notice any changes in your vision, if you notice sensations that you don't seem to feel, numbing, or any changes in your facial features, like it's harder to make certain facial features, you need to call your physician and let them know, and they can schedule an appointment to check it out, okay? All right. Okay. I hope you have a good day, and just see the receptionist out front.